Hello, my name's Bran Morse and this is my story about my back injury and how I got dependent on painkillers. October 2009, I lifted something in work and a couple of days later I could barely move. As time went on, I went to the doctors and I was prescribed painkillers, which helped but just masked the pain. I was then diagnosed with a prolapsed disc. And as time went on, the pain got worse. First time I met Dr. Jeffs was when I was a patient in County Hospital, and she was keeping track of the medication and reviewing it. I was a patient of hers within the pain management team, and I saw her team as on a one-to-one basis. First of all, seeing the psychologist and the physio. My sessions, I was actually in bed. It took a lot out of me to actually be able to come to the sessions and the appointments, but it was something I knew I had to do. Somewhere along the line, can't really remember timescales, but I was diagnosed with an extra vertebra, so all the pain medication and pain relief injections weren't actually working because I had the extra vertebra. I was on a huge cocktail of medication. I think it was a total of something like 40-something tablets a day. After the 6-month stay in hospital, I returned home, still on the huge cocktail, and spent another year in bed prior to having some surgery. My pain is very different because I don't have pain anymore. My surgery has done the job, so I no longer needed the medication, but at the time I didn't know that I didn't need the medication. After my surgery, Dr. Jeffs took me under her wing and I was having individual sessions with her. Going to pain management actually gave me the insight into what pain has, the way pain has an effect on the body. The science behind it, the understanding of what happens when the pain cycle begins, and it just gave me the strength and determination to move forward, to be able to very slowly, with the guidance of Dr. Jeffs, wean off the medication. It wasn't easy. There was a lot of side effects coming off the medication, and it's not something you can do quickly. It has to be managed, it has to be done slowly, and it has to be done with support of not just professionals but family. So to anybody who's on a lot of pain relief, and you feel that you're not in control and you want to take that control back, then seek the advice, get the help, ask the question. There's such a large chunk that I don't remember. I was existing. Now I'm living, so I've got my life back.